The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor, and each and every Friday and Saturday we get together and we talk about all things relating to your health. And I want to say we have something special coming up. It's Congenital Heart Defect Awareness Week. And this is a time when we really talk about your heart and all the things that go along with it and how we can bring awareness to it. And also, and it may be a little bit fast moving because we have somebody here who's actually living and breathing and dealing with this disorder. So can you introduce yourself, Ms. Joanna, Doc?
Yes, my name is Dr. Kregiel, Joanna Kregiel. I work at HSA. I'm cardiologist.
And also we have with us Ms. Evans. Good morning.
Good morning. Thank you for having me.
So let's start off by talking about what exactly is congenital heart defect.
Congenital heart defects is abnormality of the heart which we're born with. Usually affect the heart structure, but in very, very rare conditions sometimes can affect the electrical function of the heart, and we're dealing with what we call complete heart block. It's very rare condition, but majority of cases affect the structure of the heart. Heart has, as we all know, 4 chambers and some vessels. Right heart, which consists of right ventricle and right atrium, pumps blood to the lungs, which picks up the oxygen in the lungs and return blood to the left heart through the pulmonary veins, and then through the aorta from left ventricle to entire body to supply our brain, our kidney, all other organs.
Wow. And folks, to make it easier, of course, congenital heart defect, we're just going to call it CHD. That's kind of the kind of go-to terminology for it. And now that we have a very clinical and very, I want to say, exact name for it, I'd like to talk to Ms. Evans about it as far as being a mother of someone who has this defect. And how did you find out about this?
I find out postnatal after my son was born.
Okay, so immediately after having a good birth and everything, you find out about this defect.
Yes, it was really difficult for me and my family to
Wow.
find that out.
So had you ever heard of this before?
I did, but not to the extent that I know now.
Mm-hmm. It was a real, I would say, eye opener, because automatically after they do the postnatal check, did they find out immediately, or was it a few days or?
A few days after, when my son started having some signs.
Mm-hmm. Exactly. And what were some of those signs?
Well, for congenital heart disease, the babies can have sometimes a blue color on the skin. It calls cyanosis, and medical terminology. Dr. Joanna can elaborate a bit more on that. Sometimes the heart goes really fast, like the rate goes really elevated. Those are some of the symptoms that were present. But Dr. Joanna can also comment on other symptoms.
Yes, congenital heart diseases can be divided in very, very small defect, which patient or newborn has no any symptoms, can have symptoms later on or not even at all, but can be very dramatic just after birth, with very complex congenital heart defect when the baby is getting blue, as Miss Ivan said, because the lack of oxygen is getting the breathing is very fast, the blood pressure can come down.
Very shallow breathing.
Very shallow breathing, very fast. It means we're dealing with really, really complex congenital heart abnormalities, which can affect one of the valve, can be completely missing or completely closed, never open, can be missing or undeveloped one of the chamber of the heart, or a lot of shunt between, or something with aorta or interrupted aortic arch. Very, very complex, which such baby needs intervention very early, even in first week of their life or first few weeks of the life. Not necessarily the complete surgery, but some intervention in very early stage.
And that's what I'd like to kind of take a note at, is the importance in us talking and bringing awareness to this condition, because action has to be taken quite swiftly and quite immediately within first a few days or within a week. Would be clear in saying that, Doc?
Yes, so congenital heart disease affect like between around 0.8 to 1% of birth. So it means 8 to 10 per 1,000 birth. 25% is critical.
Okay.
Critical congenital heart abnormalities. It means this group of babies, they need intervention in first year of the life, sometimes first weeks, sometimes first few months. It is the most common cause of death in infancy from all congenital abnormalities.
Wow.
So it is quite important.
And I when you think about a successful birth, most mothers and fathers are completely ecstatic. You're tired, you're happy.
Yes.
You don't look to see if your child is blue or not. You look, immediately you look for fingers, toes, hearing, ears. You can't see inside the child. So we need to talk about things that you can see outwardly to give some indications of there may be something seriously going on inward. Would I be correct in saying that, Ms. Evans?
Well, yeah. I mean, in my case, my son was born and then he was stay at hospital. Also, he was born prematurely. That's another thing with Nolan. He was born early as well. So he was in hospital most of his life. It's not like I took him home or I will be able to detect that at home. Like other parents perhaps see some abnormalities. My case was a bit different because he was always in the hospital.
Okay, because he was a premature child.
Yes, that's what he was in the NICU, and then after that's when the other signs happened during the time when he was in the NICU.
Exactly. Okay.
And he was born with a critical one, so he has surgery after 2 weeks of life. The first surgery, because he has many surgeries. Many surgeries.
So the first one was literally within a week of his birth.
It was around 2 weeks, and he was weighed 4 pounds.
4 pounds. Wow. So Doc, talk about the awareness and surgery. You said there has to be some sort of intervention within the first few weeks of life.
Yes, when we're talking about the most critical abnormalities of the heart, it is usually the long journey, and we never know how it end up. Of course, we're hoping for success, but usually the stage treatment, many times the babies needs a little bit improved supply to the lungs, or even to reduce supply to the lungs of the blood. So sometimes we create shunt between vessels to supply better the lungs. Sometimes we need to do banding. Later on, correct different abnormalities like shunt, like sometimes open the valve, and in many cases, final surgery, which is done later on when baby is 4 or 5 years old. And to be honest, when we're talking about most critical, most complex congenital heart disease, we never know when will be the last surgery or intervention. We have patients, when I came, I was thinking about how many patients we see, and even now I have one who is in US, who is 22 years old, and she's getting the treatment for another stage of her treatment for the very complex abnormalities.
I was going to ask about that. When, because Ms. Evans alluded to the first surgery, one of many, this can go on for several years. It could be, as you said, you have an adult in their 20s who's now finally going through some of the latter stages of surgery.
Because right now we have more adults with congenital heart abnormalities than children, because with progress of technology, advances in medicine, in surgery, in intervention, more can survive to adulthood. So in community, in fact, we have more patients with congenital heart abnormalities who are adults. And we have 20-something, 30 even.
Okay.
So, and we don't know the natural history, how long they will survive because of the
okay.
But it's very fascinating, to be honest. I always, because I know exactly the patient wherever you go, what they need. I follow them. We follow them quite closely, and we never know whether it's another one stenting is needed for pulmonary artery. We follow them simply.
I was going to ask about that. You know what? Let's take a quick break and then we'll come right back. If you're just tuning in, we're talking about CHD, Congenital Heart Defect. We are doing an awareness week. We have with us, of course, Dr. Joanna, cardiologist, and we have also from Team Nolan, the founder, Miss Evans, who alluded to her son, Nolan. So we're going to take a quick break and come right back, and I'll start off with the question of bringing awareness, and how often do you see a patient? How often Ms. Evans actually had to go to the hospital? We'll take a quick break and come right back. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's Cardiology Clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together at 1 p.m. and we talk about all things related to your health. And this week, we're talking about CHD Awareness Week, which is Congenital Heart Defect Awareness Week. And we have with us Dr. Joanna. She's the cardiologist over at the HSA for the cardiology team. And we also have a CHF member and also Team Nolan founder, Miss Evans. Hello, ladies.
Hello again.
Hello.
Thank you for having us.
Thank you so much for talking to us and bringing awareness to this condition. As you alluded to, literally out of 1,000 births, quite a high percentage could be born with congenital heart defect.
Yes, so I found out how many we have delivered in Cayman Islands. So it's around 700 per year.
Okay.
So it means we expect around at least seven babies with congenital heart disease.
Wow.
Which is not maybe too many, to be honest, because we're talking about all of them, not only those critical, which are very complex or very, very dangerous. But when I looked how many were born last year, exactly the Cayman Islands meet this criteria of statistics, because 2 were born with very complex abnormalities, and they needed surgery in very early stage of the life. One is still right now in US and getting another stage surgery. So 2 were with complex critical abnormalities.
Right. So we really fall into the numbers game, as I said, fall into understanding the numbers.
Because the rest will have them much mild abnormalities like small shunt, like
when you say shunt, you have to explain to the listener.
Yes, it's some connection between or some small hole in between left and right atrium or left and right ventricle, or some mild stenosis of the valve, and valve is a little bit narrow. Doesn't need an intervention in early age, maybe not at all, but of course it's still congenital abnormalities.
Right. And I was going to ask this before we took the break, is how frequent do you see patients? Of course, you alluded to literally from birth until adulthood, but how often do you see the from the mild to the very rare?
Everything is very individual, because the patient who is with critical abnormalities, we need to see them quite often.
Okay.
But the patient who has mild abnormality or moderate, we see them every 3 months, every 6 months. We do the heart ultrasound, we monitor clinically, and also do some other tests just to see whether at some point will be something not needed,
right.
Some intervention not needed.
And let me switch gears and talk to you, Ms. Evans. You told us in the story that within the first 2 weeks, Nolan had his first surgeries. How fast did you become a professional in the medical field with understanding of what was going on?
I tell you, while I was there at his bedside, I took my free time to learn. So I read and ask questions to the medical team, and that's the reason why I know a lot now, so that I can share with families and assist others emotionally as well, because there are some cases that people sometimes reach out to me to talk because they know that I could give some
Right.
sort of comfort, or they want to share something that maybe other people will not understand because they have
Haven't
no
gone down that
experience
road yet.
and the mother role of a
Mm-hmm.
of a parent with a child with a congenital heart disease.
If you don't mind me asking, what year was this that you found out?
My son was born in 2017,
Okay.
on
okay.
June 2017.
Okay. So compared to, and Doc, you can help me with this. Compared to what we know now, back to that time frame, how much information has expounded, grown, treatment options? Just a rough idea.
I mean, the most complex congenital abnormalities of heart, not only heart, but in general, but also heart, should be detected still when the mom is pregnant.
Mm-hmm.
Sometimes it's not easy to detect this, because this would be ideal to plan delivery, to sometimes to transfer even patient to the center when can be delivered and can get treatment straight away, or at least plan this treatment.
Okay.
Every obstetrician does the ultrasound between 18 and 22 weeks of pregnancy, also to screen for the heart abnormalities.
Mm-hmm.
Of course, sometimes it's difficult to detect, but the most complex should be, and this is something which we aim to detect when it's still in mom.
Okay.
Mom.
And when you say that, it gives you some treatment options prior.
In some selected cases can be treated even when still
Inside of mom.
inside, but in very selected cases, not in
Okay.
all of them. But at least when we know what to expect, still has to be confirmed after birth, because the images in utero are not exactly the same like after birth.
Mm-hmm.
But at least we should know what to expect with the baby, and how best care to provide for both the mom and for the baby.
Understandable. So, Ms. Evans, what type of CHD was Nolan diagnosed with?
He was diagnosed with truncus arteriosus. Basically, my son was born with one artery. It should be two. There was a mixing of blood, and yeah, it was critical.
Oh, okay. So he was, rather than the two, the left and right, he was only born with one.
Yeah.
Wow. You hear these stories, but I would not think that Cayman was open to this also. Doc, how rare is that?
It's extremely rare, because when we say it's 1% of total, and this particular will be 000 something.
It's
So
extremely rare.
But we have two patients with the same.
I know a teenager that
Exactly.
that survived, and he's doing great. So I'm so happy to see the good stories.
Yes,
It brings joy to my heart to see the good stories.
Exactly, and that's I think part of what we really need to do is talk about the success and talk about the positive outcome, because as you said, Team Nolan, you are there for support for other families that have to do this path, who's going down this road, because you had to do it and you learned so much, and you're able to give that knowledge and help partake with it, because no one else could really explain it from your standpoint but you, as a mother, as someone who is on the other side from the doctor, because I love you doctors, but sometimes it sounds clinical. It sounds exact, versus you said somebody can call you because they cried on the phone. It'd be kind of hard for me to cry to my doctor. I would have to be right there. So tell me a little bit about that.
So yeah, for me, I mean, it is rewarding to be able to assist other people. I get a call 2 days ago from a friend that I know that told me, I know someone that they have been diagnosed, the baby, she's expecting, and the baby has been diagnosed with CHD, and she want me to talk a little bit to the mom to give some advices or whatsoever. Like I was happy to help and to provide some information, some tips that for me in those cases, planning is the key. You need to plan, like Dr. Joanna say, like what you're going to do. I mean, initially,
Stages,
the stages, if it's critical, what you're going to do, what's the plan after the birth, if the baby will have to need immediate intervention, like what the center that you're going to choose for the intervention, etc.
And Doc, we're kind of getting to that critical stage of talking about the different types of CHD specifically. We've talked about the rareness of it. Are there other types that we have here within Ailian, and also just so parents can hear and understand the level that they need to possibly be aware and deal with if they were diagnosed with something of this nature?
It's different classification of congenital heart abnormalities. We can divide them for very mild, like I mentioned it before, like small shunt or small hole between chambers, or very mild narrowing valve. We talk about moderate when it's a little bit more complex, to very, very complex with not only one abnormality is present. Many times it's abnormality of the wall, of the valve, of the vessels. And another classification, which I well know, is to divide them for cyanotic heart disease and non-cyanotic. Means that when baby is blue, because of lack of oxygen, and the most complex congenital abnormalities, heart diseases, are cyanotic, and one of these is truncus arteriosus, but also left heart,
the
hypoplastic left heart, or one chamber, like double outlet for right ventricle, or abnormal return of pulmonary veins. Tetralogy of Fallot, I'm sure a lot of patients they
be aware of that.
Be aware. And some others which are not cyanotic, like coarctation of aorta, different VSD, means interventricular septum defect, which is also, not very common, but important. Some of them, when we're talking about symptoms, and congenital heart abnormalities, not always the symptoms are present at birth. In less complex, the symptoms can present later on in the life or even in adulthood. But still, some of them are important, very rare. Like, for example, anomalies of coronary arteries, usually detected very late or incidentally even in adulthood. Sometimes can cause sudden death in athletes, for example. So it's full variety of spectrum of abnormalities, which
you can hear that there are a lot of moving parts with it. Which brings me to the Team Nolan Pediatric program that Ms. Evans have alluded to. Tell me a little bit about the program, and when you think of it from a pediatric standpoint, it's usually the doctors are putting together the programs and things like that. Talk to me about what you did.
So we call it pediatric because it's for children, and it's part of the Cayman Heart Foundation, which I am a member and director of the Cayman Heart Foundation. So the pediatric program will be providing financial assistance to parents when their baby is born with a congenital heart disease. Sometimes the babies have to be sent overseas, and the parents have to be long time without work, and we do assist financially to cover bills, hotel bills, food, rental, anything that needs to be paid while they are taking care of the baby at the bedside for people that are in need. Yes.
Oh, wow. And that's a significant help, because the journey of raising CHD awareness is that there is a financial strain on the family. There is a not only an emotional strain, but you're dealing with the youngest of the young, plus how your mind is all over the place. So work, health, those types of things really take second place to taking care of your child. So it's great to know that you are able to do this. What are some of the achievements and the progress you made with that?
So today we have raised incredible amount of funds to assist families. We have assisted many families. We also have donated equipment to HSA. We donated a transport a transport incubated, as well as a heart monitor for the intensive care unit. That's part of donations from the Cayman Heart Foundation. And we do continue to, for awareness, do the Heart Warriors and Angels Beach Walk that took place on February 11th at Public Beach. Over $27,000 were raised, and that will be used to assist families in need when their baby is born with a congenital heart disease in the Cayman Islands. If you have any questions, you can please contact the Cayman Heart Foundation. We have the Facebook page available so people can reach out.
So you sound, Ms. Evans, very versed in this. And pardon me for asking this question, but before your son was diagnosed with CHD, what did you know about it?
I heard about it, but I didn't know in depth of it. I learned of it after my son because it was relevant. I need to know as much as possible. I was there by his bedside, even sometimes questioning the nurses, what they do, what they not do, and I wanted to make sure that everything was right. Or, you have to be there as an advocate for your son, for your daughter. You have to know so you can ask questions and know what's going on. Because sometimes if you don't ask questions, I don't know, maybe they don't feel comfortable. I don't know, it depends. I do ask questions. I like to know.
And I would think that, for any person finding out about any disorder, you want to know as much information as possible. You want to know what treatment is. If a parent, and I say parent, but anyone they see a needle being put into an IV, they want to know what it is. What's the outcome? What is it supposed to do? So imagine something as complex as this. I mean, the learning curve had to be quite steep that she was like, okay, I need to learn as much of this as I can, as correctly and as fast. So you ask questions. I mean,
I also evidence because I was there by his bedside.
How many times did he leave the island?
Well, Nolan was, it's very emotional for me. He only came home for around 3 weeks.
Okay.
The rest of his life, he was at the hospital.
Wow. Take your time. It's okay.
It's normal.
It's fine. It's normal, and this is who I am, and I'm okay with it.
And with that being said, and Doc, you can help me with this. Are parents and families allowed to be in there? Because certain treatments, you can't be in. It's got to be sterilized. This has to be. That's extremely hard for a parent.
Yeah, it is extremely hard. It is journey, and it is affect the entire family, the parents, the siblings, if baby has already, and usually takes time. It's not like 1 or 2 weeks to be in the hospital. Many patients are born premature, and one of the reasons is because of complex congenital heart abnormalities. Can be something else associated with another abnormality of another organ. So some of them are born very premature. So
when you say
premature means 25 weeks of pregnancy or 30 weeks of pregnancy, definitely before 36 or 38.
Right.
So it means they are immature as well. Their organs are not developed, and they need to be in the hospital not only for the heart but for other conditions in very specialized critical care unit, neonatal critical care unit in overseas. So for family it's extreme effort, extreme sacrificing, and I can imagine only how much efforts, how much emotion, how much everything.
Wow. And
I always appreciate, and I always have a lot of respect and a lot of understanding. And even if sometimes, as you said, we are professionals, so we talk only about medical side, it's not fully true. Of course we have to do it, but
the humanistic part of it is in the, for me, hearing the story, how can you tell a newborn that it's sick? There's no way. So this child is in this world and is trying to get what normal children do, but they don't know that they are sick, and you haven't been able to touch your child or hold it for weeks on end because it's a premature baby, and now you found out that it has congenital heart defect. it seems like a snowball effect that you're having to deal with. And had you ever heard of anyone else in your family or in your circle having to deal with it, Ms. Evans?
No, not in my family, but I know a lot of people. I know people on island as well as overseas that I met during my stay at Nicholas Children's Hospital, and we have developed great relationships. I know families all over the world that I met there, and I also know cases here in the Cayman Islands as well. Yeah.
Right, and that I think is the experience that no one can prepare you for. You know, we hear, oh, you get prepared to be a parent, you're doing all of these things, you're going down that route of a natural birth, you're doing all these things, and all of a sudden you find out, or, you know, after birth you find out that, hey, there's an issue that we need to address. You know, for a lot of people, I guess what I'm saying is the day-to-day routine that you had to go through was what, Miss Evans?
My day-to-day routine was machines beeping and medicines being supplied and be there with my son. That was the day-to-day. The
day-to-day, just being there to make sure that, I mean, of course, he got the best that there was, but as a parent, we want to see, we need to know what's going on. Wow. Okay. We're going to take a quick break and come back. We're going to drink some water, dry a few tears, and we're going to talk about some of the success that we're having right now. If you're just tuning in, this is Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking about Congenital Heart Defect Week. We'll give you some more details about that and bringing awareness to it. And also, if you're a person or your family member is experiencing this, how to reach out and also give some information, get some help. We'll talk about that in just a few moments. We'll be right back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's Cardiology Clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and each and every time we get together, we always try to bring you the realness of what it takes to be here in the Cayman Islands. And sometimes, you know, we forget that there are stories here that involve the youngest of us, and they don't have a voice to talk. So we try to talk and let others know some of the journey and some of the things that our younger ones are going through, and specifically congenital heart defect awareness. This week, we were basically setting up and talking about it. I have with us Dr. Joanna. She is a cardiologist over at the cardiology team at HSA. And I also have with us Miss Evans, who is Team Nolan founder. And before we broke, we were talking a little bit about the day-to-day routine that you went through, Miss Evans. For someone out there who, say, God forbid, yesterday they found out, now they have to get in their mind what a routine will look like. What did your routine turn out to be, Miss Evans?
As I was saying, I really was involved with my son's case. I guess the routine will be on a case-by-case basis, because if it's a mild CHD, the parents will have more time to plan a little bit, and the baby perhaps could even go home with medicine and then supervision from the cardiologist, and then, keep going to appointments until it's the prescribed treatment happen. But in my case, I was sent out overseas, and I was based at Nicholas Children's Hospitals for, I will say, around 6 months, because my son only spent home like 3 weeks of his life. All the other time he was hospitalized.
So premature, 2 weeks you find out, surgery, 3 weeks, and then 6 months overseas, away.
He has multiple surgeries, was the only one.
Wow. That's
and heart surgeries for this young fragile baby, it takes some time to recover, and then he developed a pulmonary hypertension, that is like high pressure of the lungs. So that's a complication that
arose from that.
Yes, and he has he passed away with a cardiac arrest and has a hypertension crisis that are from his defect. So sometimes you have the defect, you have surgery, they fix it, but then there is other things that come, and then some more surgeries that needs to happen, etc.
So really, they're working on one. Something else arises, they need to address that. It's almost and Doc, you can help me with this. A case-by-case study for each and every person.
Case by case, and in most complex, the patient is never cured. It's always more or less palliation. Means we help, but we cannot say they return to average at least. We never know. It's never cured, except very mild abnormalities. But in moderate or particularly severe, they always may have some complication, some limitation later on, some condition which affect the future life as well. Not only this tragic case, but also affect their functional capacity. They cannot walk too fast. They cannot do certain things. We try to do the best, but we are all a little bit limited, despite of advancement, huge and tremendous advancement in the surgery, in any technology, in intervention, because it's not only surgery, open heart surgery, but many times is intervention, like through the veins to make valve a little bit more wide, or to make vessel a little bit more wide, to put stents. Despite of this, still we have the quite tragic outcome, which we need to also, which is very challenging, not only, first of all, for parents and family, no doubts about it, we don't discuss even about it, but also for medical community.
Yeah, because I mean, you're limited to what the body can handle in certain cases, but as they get older, the medicine and also I would hope and think that for persons out there who are living with these different types of heart condition, that the support system and understanding gets wider, and more people are helping towards the understanding of it, and that's why we're here to kind of bring awareness to that. If you can, Miss Evans, if a parent is out there and they have a child with CHD, what would you tell them?
I will tell them to have hope, and if you want some assistance, please reach out to the Cayman Heart Foundation. The number is 916-633-24. Again, 916-633-24 is the Cayman Heart Foundation. We are there for you emotionally, and if there is assistance needed, if your child is sent overseas with financial bills or etc., we are there for the community.
Exactly. And I wanted to allude to you, Doc, types of treatment available. What types of treatment do we have? Also, she alluded to some machinery that the HSA have and things of that. Give me a little wider view on that.
We always start from medical treatment with medication which support the circulation and heart. Can be diuretic, can be different type of medication which support the circulation, like sometimes what we call inotrope to keep the blood pressure, to reduce the pressure in pulmonary arteries. We have type of surgeries which can be done, some of them on island, majority I think in very specialized centers overseas, in US or different places as well, not only. Some patients later on they may need future intervention like catheter ablation for the arrhythmias, like catheter intervention through the vein or arteries for stenting of arteries. Some of them they may need, and we have patients with pacemaker, the children with pacemaker. Some even need heart transplant as well. So full range like in adult cardiology as well.
I remember that case of the heart transplant that family was so thankful to you. They give you such a big hug. Do you remember the case of the heart transplant?
Wow.
It must be rewarding for you. They were so thankful to you because you was there for them.
It's not easy sometimes to get. We're also dealing with a little bit financial issues because not all patients have full insurance, and
Exactly.
that's why the Heart Fund helped us. And
Very good.
She knows how sometimes it's difficult to send patients overseas because of they are very costly. There's a lot of money. Financially, is very.
And I find that the insurance, they wanted to send your child sometimes to the cost-effective place rather than look after if it's the best. I mean,
And see, that's one of the things I think that people need to reach out to someone like you, Miss Evans, someone who has been through it, because you would have done the research. Because if I was, I just use myself an example, if I was told today or yesterday that, my child or someone in my family had this happen or developed this, I probably would be at such a loss I couldn't think straight. So having someone who has been through it and been able to connect the dots and know the road to travel to say, okay, you know what, this is a better one than this, or this is a closer one because you need to get in right away, or whatever the case. I think that is part of the understanding that you have that I think people really should be tapping into and having that conversation with you over there. We're going to take a quick break, but I wanted to ask before we got out of here, and you can think about this, Doc, and what causes CHD? Is there a specific or you want to hold that question and we come back and we start with that one? Okay, we're going to take a quick break and come right back and start wrapping up. You're tuned into Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and we talk about all things related to your health. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's Cardiology Clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. As we start to wrap up, we're talking about Congenital Heart Defect Awareness Week. Basically, it's a week that we talk about bringing awareness to this defect from the heart, and also treatment and also connectivity. When I say connectivity, people who are in the know, who are able to help anyone who has need to address it. Before we left, Doc, I asked what causes CHD, which is congenital heart defect. What causes that?
Majority cases we don't know really. And we have very healthy parents, nothing in family, there is no any congenital abnormalities in the family, and suddenly the baby is born with complex or less complex congenital heart abnormalities. We know when somebody has congenital heart disease, the one of parents, the risk to have baby with congenital abnormality is 20% higher. We know some medication can cause associated with congenital heart abnormalities. Some anti-seizure medication like phentoin, like other medication, which sometimes the mom has to take, is associated with, and we need to be aware of this. Some viral infection, particularly rubella. That's why everybody should be really vaccinated as a teenager or early age for rubella, because this one was documented is associated with some congenital heart abnormalities. Sometimes condition of the mom, particularly mother condition, because the mothers are having baby in a little bit later age as well. They have sometimes diabetes, sometimes other cardiovascular risk factor which can affect the baby. Particularly diabetes is associated with some abnormalities of the heart. Some, like lupus, maternal lupus, can cause the complete heart block. And some genetic abnormalities, genetic syndrome like trisomy Down syndrome or Noonan syndrome, Turner syndrome. This is genetic abnormalities which are associated with higher risk of the congenital heart abnormalities. Of course, the smoking, alcohol, so some lifestyle.
Yeah,
associated
we
with.
definitely want to stop that right
Absolutely.
away. Those
some
are
pollution possibly.
Those are things that we have. I call them the human effect. We can directly relate and control those things and stop those things. When it's family related and things of that nature, and it's DNA related, we really don't have any outcome for that. But smoking, alcohol, drugs, things of that nature, we know that they are not healthy for.
Yes, genetic testing is available as well, and just make sure when you are pregnant, you need to attend a natal clinic and to have a checkup of your health in general.
Exactly.
Particularly at that stage, of course.
At that stage, yeah. And switching gears, Ms. Evans, before we start wrapping up, what would you say to someone out there about the journey of dealing with CHD?
It's a very challenging journey, but you have to remain hopeful. And I know that there are cases there that there is, at the end of the tunnel, there is light, and then the children survive, and they are thriving, they have a normal life, or at least as much as possible normal, and I'm really happy to see that. Not every case will be like mine, but I'm here to help other people.
Okay, excellent.
So there is hope is always there, and it's important. And again, I'm available to anyone that needs some emotional support or any questions on my point of view. I'm always available.
That's right. As a representative of
the Cayman Heart Foundation.
As a Cayman Heart Foundation. If someone's listening in right now and they wanted to get in contact with the Cayman Heart Foundation,
they can call 916-6324. Again, 916-6324. We also on Facebook and Instagram, Cayman Heart.
Exactly.
Heart
And not just emotional support, but also an assistance with some financial also for them.
Yes, we have a forum for that
Excellent.
The parents can complete for assistance. Yeah.
Excellent. Once again, ladies, thank you so much for stopping by here today. We've been talking about Congenital Heart Defect Awareness Week. Just wrapping up, Doctor, if you want to say anything to wrap up here.
Thank you for having us again. We came last year. I went last week or 2 weeks ago for this wonderful walk again, to beach walk. I'm always very inspired and excited to see a lot of people who come with children, with whole families for this walk. Every baby, I mean, is absolutely special, particularly congenital heart abnormalities or any heart disease. And I have this privilege to work at HSA, and where this majority of babies are delivered in maternity ward. So I am many times asked, or almost always, if something may suggest some abnormalities to come and do the heart ultrasound. And majority, I hope, at least were detected. And later on, I have this privilege, absolutely privilege, to see patients how they manage, how in later on their life, from very little newborn to 20, 30. It is something which is worth it to be a doctor, simply.
That's good. I love those stories, and thank you for all that you do and continue on that path. And Ms. Evans, if we're wrapping up here, would you like to say a few words before we get out of here?
Thank you so much for having me. It was a privilege. Thank you, Dr. Joanna, for inviting me to share this space with you. Definitely for me, it's really rewarding. I love to share the story so people can know, and they may not feel that they are alone, because when I was there, I didn't know who to talk to. So
Exactly.
I'm here for the community.
Thank you so much. Ladies, once again, thank you so much in continuing the path. And folks, if you're out there listening and you do need support, these wonderful folks are here for you. Thank you, ladies.
Thank you very much.
Thanks.
Thank you.